everyone. Welcome to our April Talks on Tuesdays webinar using BCBAs as providers of developmental services. We are going to be talking about that whole mouthful of acronym that I just used with BCBA. But for the purpose of the webinar, when you do hear that, please remember we also talk about BCBA assistance, and we are just going to use the term BCBA. So again, we're glad you're here to join us, and we're going to go ahead and get started. We are delighted to have 3 presenters who will be joining us today, and I'm going to ask them to each introduce themselves and tell a little bit about what they do. So Catherine, could you start, please?
Yes. I guess good afternoon. This is Catherine Hancock. I'm the Early Intervention Administrator for Virginia.
Thank you, Catherine. And Selena?
Hi, I am the Assistant Director for Training at the VCU Autism Center for Excellence, and I'm also a Board Certified Behavior Analyst, or BCBA.
Thanks, Selena. Carol?
I'm Carol Burke, and I'm an early childhood special educator, and in my local system, I'm a service coordinator, a developmental services provider, and also the local system manager.
Sure, many hats. Thanks, Carol. And again, if you just joined us, I'm Corey Hill. I work at the Partnership for People with Disabilities at VCU, and I am the Professional Development Specialist. We wanted to be sure and remind everybody that April is Autism Awareness Month, and so it seems like when we first started talking about what our topic was going to be for our Talks on Tuesday, it seems like this was a really good opportunity to promote awareness about autism and to support Autism Awareness Month. So let's take a quick look at our agenda for today. We are going to have a quick overview about what COPA actually is, what we know about autism and the use of BCBAs, COPA questions, and then we're going to get to hear one system story about how this was implemented. So I'd like to share just a little bit about COPA, which stands for the Community of Practice in Autism. And the framework for our webinar discussion today actually happened because COPA members really had questions about potentially using BCBA providers. And so we have built this web discussion around the questions of the Community of Practice in Autism members. COPA actually began in 2007, and there have been many iterations of how COPA has looked. But when we first started, it was very prescribed, and there were set activities. And as we've moved towards a more true community of practice approach, we are now meeting statewide, and we meet one time every other month by phone for an hour, and members share information. They determine what they want their topics and their agenda to be. Our next COPA call is May 23rd from 3 to 4 p.m. And if you would like more information about the Community of Practice, my contact information, my email, and my telephone number are on screen. The other place that you will be able to find a lot of really nice information is on the COPA page on the Virginia Early Intervention Professional Development Center site. And Jeannie, if you can put that site in the chat, I would appreciate that. So there you go. Jeannie just posted that. Again, if you have trouble finding it, just feel free to call or email me, and I would be happy to share information. But again, it's been really exciting to see how COPA has morphed over the years, and everything you're going to see today is a result of COPA members kind of sharing their questions. So I'm going to go ahead and turn it over now, and Catherine, if you would be willing to talk a little bit about what we know.
Certainly. Thank you, Corey. Well, what we know, and I think most of you on this call are already well aware of this, but early identification of developmental delays and intervention are crucial to improving outcomes for infants and toddlers. Research supports the practices that we've adopted for early intervention in Virginia, and some of these include providing services in natural environments, using coaching techniques, and functional assessments. But there isn't a lot of research on techniques that benefit infants and toddlers under 3 who are suspected of having autism or who have other problematic behavioral issues. But there is some support for interventions that are taught to parents, which is great because that's what we do in early intervention. In an effort to broaden the expertise available in early intervention, we decided to allow board-certified behavioral analysts and board-certified assistant behavioral analysts to the list of persons who can provide early intervention developmental services, and this was done in December of 2014. And while we generally think of BCBAs and BCABAs as providing autism services, they can also provide assistance with other conditions and behaviors as well. The techniques used by BCBAs and BCABAs, such as prompting, reinforcement, modeling, are consistent with our early intervention practices. And Selena's going to talk some more about this in a few minutes, but first I'm just going to talk a little bit more about how BCBAs and BCABAs will participate in early intervention services. The addition of these new providers does not change how early intervention services are identified or provided. As part of the early intervention certification process, behavior analysts and assistant behavior analysts who want to provide services in the early intervention system in Virginia will be required to complete the early intervention modules and sign and follow the same assurances as all other providers are required to do. This means they will plan and develop services and deliver services as members of teams. They will use coaching and natural learning environment practices and adhere to the principles of early intervention and follow the practice manual. Also, if a BCBA or a BCABA is interested in becoming a provider in early intervention, I encourage them to talk with the local system manager to find out how they can join the team and how they can potentially work together. And as the title of the session today implies, BCBAs and BCABAs will be included as providers of developmental services. So therefore, no new services have been added, but they will be providers of developmental services. So Selena, can I turn it over to you to talk some more about how early intervention services can be provided by BCBAs and BCABAs?
Sure, thank you, Catherine. So BCBAs and BCABAs are highly trained individuals in the area of behavior. And I'm going to use behavior as a broad term that encompasses what you probably already are thinking of, which is interfering behaviors, and that can include, of course, anything from hitting to kicking to biting to screaming to basically any other unwanted behavior. However, it also includes other kinds of behaviors such as refusing to eat certain foods, difficulties with social interactions, communication needs, and so on. Additionally, it's important to note behavior analysts also work on skill acquisition. This can include teaching individuals in the area of gross motor, fine motor, communication, social skills, daily living skills, academic skills, and pretty much any other skill you can think of. In essence, behavior analysts focus on what's important to the individual and their family to assist with increasing skills and decreasing undesired behaviors. So what do behavior analytics services look like? Well, it all depends on what's needed. Behavior analysts can provide a functional behavior assessment to determine the function of a behavior, and they can develop and implement a behavior intervention plan to address those behaviors. Behavior analysts also can train others to implement behavior plans and or behavioral strategies such as shaping, chaining, reinforcement, etc. Behavior analysts can help break large tasks into smaller tasks so they're more easily learned. We can also provide skill assessments to determine what skills are able to be completed and what skills the individual may still be struggling with, as well as plan to help the individual learn those new skills. Behavior analysts employ evidence-based practices to help support the individual and his or her family be more successful. But behavior analysts don't do everything. A behavior analyst doesn't provide assessments that deal with cognitive functioning, for example. A behavior analyst should only employ evidence-based practices, and behavior analysts do not typically provide counseling services or medical treatment such as recommendations for medication. However, it should be noted it's not unusual for a behavior analyst to also hold other forms of training. For example, a behavior analyst may also be a licensed psychologist, in which case they may provide counseling. So how do people become BCBAs or BCABAs? This is an important question for anyone considering utilizing services from these individuals. Just like not all speech therapists, occupational therapists, or other professionals, not all BCBAs are created equal. Let's start with the basics of the credential. So to be a BCBA, you must have a master's degree. Currently, that degree has to be in psychology, education, or behavior analysis, though previously that requirement was more inclusive of other degrees. From there, you have to take 6 courses on behavior principles, assessment, ethics, research methods, and applications of behavioral technology. You're also required to complete a lengthy internship experience where you are supervised by a BCBA in the field. If you're at the BCABA level or the assistant level, you're required to have a bachelor's degree, take a specific course in behavior similar to what I just mentioned, and also have a lengthy internship experience supervised by a BCBA. People who hold the BCABA credential are also required to continue to be supervised by a BCBA in the field. There are many areas which BCBAs specialize in. For example, my specialty area is individuals with developmental disabilities ranging from early childhood to adulthood. However, there are others who specialize in gerontology, individuals with intellectual disabilities in employment settings, adults without disabilities who want to lose weight or quit smoking, people who have specific phobias or fears, teaching children without disabilities, addictions, forensics, traumatic brain injury, and so on. Because the field is very diverse, it's important to understand the experiences and training of the individual you're considering. Behavior analysts are not required to take courses in child development, but many of us do because of our interest in other training. However, it is unethical for a BCBA or BCABA to practice outside of their scope of expertise, especially without support or supervision. So therefore, it's important to make clear what is expected when delivering services so the behavior analyst can determine whether or not they're able to deliver those services. Ultimately, BCBAs can be very helpful people to have supporting individuals, and we have a lot of knowledge and experience in changing behavior and helping individuals to be successful. So Corey, I think I'm turning it back over to you.
Yes, thank you. Wow, that was lots of good information. Thank you, Catherine and Selena. So we wanted to do a quick check to see if there are systems that are currently using a BCBA or a BCABA as a provider of developmental services. So I'm going to ask you to use your poll feature. Again, if you need a quick reminder, under in the participant gray box under your name, the 4th box over, the furthest box to the right, there is a box that has a check in it, and you hit the little drop down in the corner and choose yes or no if your system is currently using a BCBA or a BCABA. So go ahead and take the poll, and we'll see what we find out about in Virginia. Okay, Jeannie, if you can post the response. Oops. Okay, it looks like, wow, it looks like right now we don't have anybody who is currently doing that. And some people did not respond, but for the majority, the response was no. So hopefully you'll be able to get some ideas throughout this web discussion to see how this might be a possibility for your system. So again, our framework has been the questions of the COPA members, and I'm going to turn this over to Selena, but I'd like you to look at the question on screen. What would a BCBA provider do that's different from other professionals who provide developmental services? If you can put your answers in the chat box, and then Selena's going to take it from here. Thank you.
Great. So what do people think? What would a BCBA provider do that's different from other professionals? So Ashley has said provide behavioral recommendations and interventions that are targeted to the specific individual. What else do people think? Understand behavior modification techniques, provide a more of a functional assessment. Is it possible to turn up my mic? Let's see if this helps. Train other professionals that are part of the team, provide task analysis. Any other thoughts?
Looks like, Selena, a couple more people are still typing in, so let's just hang on one more second.
Of course. So yeah, it looks like people have pretty good idea of what behavior analysts do. But Leah said that they basically be doing the same thing as other developmental services, and I think that's, in a way, a really good point. In a lot of ways, there are a lot of similarities between BCBA services and other developmental providers. You know, BCBAs observe and interview individuals to determine a teaching plan and create goals for the individual receiving services. They can train caregivers, which a lot of you mentioned, and others to implement the teaching strategies so that those can be delivered if the BCBA isn't there. I think probably one of the biggest differences in service provision, and somebody mentioned this, was the use of the functional behavior assessment and a systematic behavior intervention plan process. And BCBAs do go about this in a very specific way. BCBAs really focus on why something's happening and then create a systematic plan to change that if it's needed. I will mention there's a common misconception that BCBAs provide discrete trial training all day for 40 hours per week. And though discrete trial training, or DTT, might be part of what behavior analysts do, it really depends on the individual and his or her needs or goals. And so DTT is one small part of behavior analysis and really may or may not be part of this individual's treatment plan.
All right, thank you, Selena. Let's go to see what the next question is from COPA. If using a BCBA to provide developmental services, how many hours would be provided? So go ahead and put what you think the right answer is in chat, or if you have a question about that, and then Catherine's going to take this question. Thanks.
Thanks, Corey. I'll give people a minute to write in their thoughts about how many hours a week would be provided. Yeah, see, yes, I think the approach is it would be exactly the same as all other EI providers. It would be individualized to the plan and would fit into the role of EI that we use. So thank you, Leah. That's correct. And Robin is correct too. The approach we use typically in early intervention is working with the parents. So again, you would base your assessment on what the child needs and develop that with your team. But remember too that when the parents are taught, there are additional hours of service that are being provided when the therapist is not there. And correct, whenever it's needed in order to reach the child's goals and outcomes. Yes. So I'm done. Thank you, Corey.
All right. No, thank you. That was great. We had good responses in our chat. That always makes this easier. Very nice. So take a look at the next COPA member's question. How would billing be done? And then Catherine will take it from there. So go ahead again and use the chat. How do you think billing is going to be done if you use the BCBA to provide developmental services?
Again, I'll give people a minute to write in their responses. I'll just jump in on this one. I think this one, well, they're same as other, exactly. What would happen is you would go ahead and, as Selena mentioned, some are already included providers, and so they could either bill as a BCBA, which is in the reimbursement category 2, or they could, if they were some other type of provider, they could bill their services at. But it is billed as developmental services, and one good point is raised is would BCBA be reimbursed by insurance, and that's going to be very individualized. Often developmental services are not covered by insurance, so you would need to check and see if it is those services are provided by are covered by the insurance company, and go from there. So again, developmental services might not be provided, but maybe some other service, maybe they might cover ABA services. So just you need to look individually at that and see.
Thanks, Catherine. All right, let's see what our next question is from COPA. Will there be training or support for BCBAs who are transitioning into early intervention services, and who will be responsible for providing this training? Put your answers in chat, and then Catherine will take it from there.
Thank you again. Again, I think this one may not be one that inspires a lot of people to write. I think, as I mentioned earlier, anyone, BCBAs and BCABAs are required to take all the same certifications and training that any other early intervention provider is required to take. They agree to the assurances, and I would suggest that they meet with the local system manager to talk about their role. And I do see one suggestion here, depends on how the local systems do their own training, and obviously I think local system managers would be very involved in deciding how to orient a new practitioner, especially if it's something new in your program. And I know Carol's going to talk a little bit more about specifically how she's used them in her program in a few minutes. So, but I think you're right on target there.
Catherine, if folks did have questions, if maybe they didn't do that kind of training, is there somebody from the State Part C staff that they might contact to see how they would move forward?
Certainly. I would suggest contacting your local technical consultant, or they could call me, and we'll help walk them through the process.
Great. Thank you. All right. One of the questions that the COPA members talked about is what's a sensitive way to discuss adding a BCBA provider to the IFSP, especially if the family has not considered a possibility of autism. And this actually caused kind of a big discussion, and so we wanted to be sure you all were aware that a few years ago, COPA members put together a document about just this, how to talk to a family if you have concerns about autism, and it is available on the COPA web page. Jeannie actually is posting it in chat where it's available, but in the handout that you received with resources and information prior to when you registered and when you logged in, all of that information is there, and it will also be posted on the archived Talks on Tuesday webinar. It will be posted as a resource. But again, if that's a resource that might be handy, we wanted to be sure you were aware of that. So Selena, can you offer more information about this?
Absolutely, sure. So I mentioned this before, but the great news is that BCBAs provide services and supports for all individuals, regardless of having or not having any particular disability, and especially not just for those that have autism. So a recommendation for BCBA services can be made for children who don't have autism. But if you do suspect that a child has autism, there are a lot of resources available to help you to talk with families about this topic. Corey mentioned a few of them, and I did want to, the handout that's on the slide, I did want to mention a couple of them because it's a really great handout and offers some great tips. A few of them on there are highlighting some of the child's strengths and telling the parent what the child does well, talking about specific behaviors that you've observed when interacting with the child, so parents don't take it as personally, hopefully. Trying to make it a discussion. This might be the first time a parent has ever heard this or considered it. Encouraging the parent to talk with their child's healthcare provider, and of course, importantly, reminding them that the early interventionist will help support them through the process.
Thanks, Selena. I do want to encourage you, if you guys have any questions as we go along, we will have an opportunity to have questions at the end. Let's see, Dana. Oh, I'm sorry, Robin says focusing on the strengths of the provider, not the discipline that matches the needs of the child and family. That's an excellent point, and the idea that we don't match services based on what somebody's discipline is. Okay, let's see what we have next. So now I'm going to turn it over. We have found that folks really like to hear how a system who has done just this using a BCBA provider, so I'm going to turn it over to Carol.
Thanks, Corey. Our local system hired someone with their BCABA back in 2008, and for the purpose of this webinar, I'll call her Alice. I met Alice when I coordinated our region's community of practice in autism, and because she's a registered nurse, I was able to use her as a developmental services provider, and she worked with our system until she retired in 2014. Alice typically saw children with communication, social, and cognitive delays, along with some significant behavioral issues. Some of the children she saw did have a diagnosis of autism, but not all, and none had the diagnosis when she first started to see them. If you looked at the IFSPs for these children on our caseload and compared them with IFSPs for other kids in our system, you wouldn't have noticed anything different, including with the goals or frequency of services. And if you went on a home visit with Alice, you wouldn't have noticed anything different either as compared with other providers in our system in the way she partnered with families and helped them develop strategies they could use with their children. So here's an example. Alice worked with a child named Nathan who was 19 months old at the time we wrote his initial IFSP. And Nathan did receive an autism diagnosis close to the time he transitioned out of our services. Alice saw Nathan and his mom once a week for 90 minutes, and most of the sessions were at home because Nathan's mother wanted ideas to help her get through Nathan's home routine with more success. So while the sessions happened at home, they didn't stay in one room but moved around the house depending on what was going on when Alice was there. Alice observed Nathan and his routine, and she helped his mom build on the good things she was already doing. She strategized with her to think of new ideas and then supported her as she implemented them. His IFSP outcomes included a focus on following directions, using words to request, and expanding play skills because of his tendency for restricted and repetitive play. Some of the specific strategies they worked on together included Alice helping Nathan's mom give him the least amount of assistance when teaching him something new or when she wanted him to follow through with a direction. Also, Alice introduced first then as a strategy to encourage Nathan to do a less preferred activity, like putting on his shoes, and then following it with an activity he liked, such as going outside. In addition, Alice helped Nathan's mom listen for sounds he was making that might be intentional and encouraged her to treat them as intentional when he wanted a snack or a toy. She coached her to help him shape these sounds into words when he wanted to make a request. During Alice's time of working with Nathan and his mom, he began to use words to request, followed an increased number of one-step directions, and engaged in more purposeful play. With all the families Alice saw, including Nathan and his mom, she primarily used behavioral strategies, as this was one of her strengths in terms of knowledge and skills. She helped families understand how to take an activity apart and teach it step by step, sometimes starting with the last step first, and then how to look for even the smallest improvement that indicated a child was progressing. She assisted families in identifying what happened just before a challenging behavior and what happened after as part of an overall strategy to help families better understand difficult behavior and how to change it. She showed families who were interested, and not all were, how to keep track of their child's progress on simple data charts between visits. These were just some of her skills she shared with families, and certainly she had more training in and experience with behavioral interventions than the rest of our team. But all of us on our team have some knowledge and skills in these areas, just like all of us on our team have knowledge and skills in other areas beyond our own discipline. Now Corey's going to help us with this activity.
Thanks, Carol. So we did the poll at the very beginning, and we'd like you guys to think about the statement that is on screen, and using your pointer tool, drop your pointer on one of the hands, either the thumbs up or the thumbs down. If you need a reminder how to use the pointer tool, it is in the whiteboard pointer tool is the second box down. It looks like some people are getting it, and you can drop a hand, a smiling face, asterisk, whatever you want. So let's go ahead and give you guys a second to do that. I see a few people are still putting theirs in, so I'm going to wait another second or two. Yay, that's exactly what we were hoping might happen as a result of today. So thank you for participating. And Carol, I'm going to turn it back to you so you can finish your story.
Okay, thanks, Corey. As all of you have indicated who just gave a thumbs up, you recognize what Alice did in her work with families is similar to what other members of early intervention teams might do when they work with families, whether or not the team includes someone with their BCBA. That's what our local system learned when we had Alice as part of our team. We also learned how she worked with families is how the rest of our team works with families in early intervention. Sometimes when we think of a person with their BCBA and we think about applied behavioral analysis or ABA, a certain picture may form in our minds about how that might look. Our picture might include a lot of hours of service a week with a child sitting at a table doing the same activities over and over again. And while this may be what happens in some settings, it doesn't mean it must or will happen in early intervention. It's just like a physical therapist who has a lot of experience in the clinical setting, working directly with a child while the parent watches, or maybe even while the parent's in the waiting room. And then this physical therapist comes to your program wanting to work in your local system. And this same physical therapist can take her knowledge and skills from the clinical setting and with some training and support, successfully work with families in natural settings using coaching as her style of interaction. And that was our experience with Alice. She was able to take her knowledge and skills from her other experiences and with support and training, successfully work with families in our local early intervention system.
Thanks, Carol. So we are at the end of sort of the formal discussion, but we would like to ask you to submit any questions you might have. So please feel free to put those questions in chat. And while you are doing that, again, I want to draw attention to the resource list or handout that you got. And Selena, can you help with what VEIPD stands for and how you can find who the BCBAs in the state are?
Sure. So VABA, or VEIPD, is the Virginia Association for Behavior Analysts, and it's a professional organization, not dissimilar from probably any other discipline's professional organization. That's one way to find behavior analysts in your area. Another way is to go onto the Behavior Analyst Certification Board, which is the national board that provides our certification, on their website. And you can look for people who have their board certification in any geographical area. You can type in your zip code and find it that way. I will note, though, that just because they're on the BACB website doesn't necessarily mean that they are a developmental provider or that they have interest in becoming a developmental provider. So it would just depend on what their interests were.
Thanks, Selena. I did note there have been some questions that came in. Shelby County Board of DD has asked, how much do they typically get paid for service delivery? Catherine, can you talk again about how it looks on the structure in Virginia for how services are paid?
Yes, thank you, certainly. In Virginia, the payment rate would be professionals, the BCBAs and BCABAs would be in the reimbursement category 2, which is $27.50 per 15-minute unit of reimbursement.
Okay, thank you. Shelby County, if that did not answer your question, I think you all might be from out of state, but we're happy to answer those questions if you have more questions. Let's see, Leah, if someone has a master's and many hours toward becoming a BCBA, does anyone have any resources for finding supervision? Selena, is that a question you might be able to field?
Yeah, I can certainly try to. So again, if you go on the BACB website, so it's BACB.com, they have a registry that lists everyone who's board certified, who agrees to be on the registry, which most of us do. And behind that there's a code that says people who would be willing to supervise, either BCABAs or people who want to become a BCBA. And then again, you can search by your geographic region and those kinds of things. The other option is sometimes your universities that offer the program are willing to offer supervision to people who don't necessarily take their coursework, but that would depend on the university and their policies.
Thanks, Selena. There's another question from Fairfax. Are early intervention practices addressed during the trainings for BCBAs and BCABAs?
This is Catherine.
Selena, I know you talked about what the coursework. Can you possibly say that again and field that question?
Yeah, sure, absolutely. So to become a BCABA or BCBA, you do not have to have any formal training in child development, developmental practices, anything like that. However, because of what the required master's degrees are, so of course education, psychology, and behavior analysis, that would be more than likely where you would get that kind of coursework. But again, when you're considering someone to provide behavior services as a developmental service, and as we're talking about, you would really want to get to know what that person's credentials are and what their experiences are, because we all do specialize in different things. Does that answer that question?
Thanks, Selena. Fairfax, if that didn't quite get it, please type something else and we'll see if we can be more specific. Let's see what other questions we have coming in. Rural Infant Services says there seems to be several resources listed there for finding BCBA providers and how those providers might link with early intervention, which is actually the kind of the approach we took. They want to know, what about developmental therapists or others who might be interested in training in ABA, and is there any support for that? Catherine, I'm not sure if that's something you might know, or Selena, if you know where people might get training in ABA. So I'm going to throw that out to both of you, and feel free to jump in if you can help answer that question.
Sure. Catherine, do you have anything that you want to say first?
Selena, I'm hoping that you can answer that question.
Okay. Yep, I'll give it a stab. So in Virginia, there's actually a law that in order to practice applied behavior analysis, you have to be a licensed behavior analyst. There's a few exceptions under that, but in order to become a licensed behavior analyst in Virginia, you have to hold a board certification. And the only way to get that would be to go through the course sequence and the internship experience that I mentioned. The VCU Autism Center for Excellence, which is where I work, has a page on their website that lists different approved course sequences that are in Virginia. Of course, there are course sequences all across the United States and the world, but if you're interested in the ones that are in Virginia, that would be a good place to start.
Thanks, Selena. Let's see. I am not sure we're going to have the answer. Somebody whose sign-in name is TV, Selena, and Rural Infant Services says thanks. That helps a lot. Let's see. TVOS, I think is what it says. What is the percentage of insurance companies that cover this? Again, what we would be talking about covering is developmental services because it's just like any other provider. Catherine, I don't know if you have that percentage right in the top of your head, but I'm going to ask you if you have any information to provide for this participant.
No, I don't have any percentage of that. I know anecdotally it is rare that insurance companies will cover developmental services. So it's typically something that's paid for by Early Intervention Part C.
Okay. And then I think I might need glasses. CIBH asks, why would a system, including a family, choose a BCBA to provide developmental services when a family's insurance would cover another service that would provide the same supports as a BCBA? Carol, I'm going to throw that one out to how Alice was used and how that was determined, but I do think it's important to remember that you are matching somebody's expertise rather than their discipline on what service is listed on the IFSP. Carol, do you have anything you might be able to add to that?
Sure, Corey. When I read that question, I thought, okay, if the same supports would be provided by someone else, then maybe the parent would want somebody in their insurance network. But I'm not sure that would always necessarily be so, and was not our experience when we had Alice as part of our team, because she did have some specialized skills that the rest of us did not have, especially with behavioral interventions. So if there is somebody on the team that can do the same thing, then maybe the family would want somebody in their provider network, but otherwise they might choose someone that has the skills and the knowledge that would best help them meet their IFSP goals.
Thanks, Carol. Danny from Chesapeake notes that there are also some good online programs. Danny, I think you might be related to ABA training. Is that what you were responding to? Just type in chat if I got that right. Let's see. Yes, she says that's what she was. Okay, I'm going to look and see if I've missed any other questions. If you have any more questions, feel free. Just give me a minute and let me make sure I didn't miss any. I think we've gotten them all. Let me do one last quick check and see if anybody else is still typing. Oh, I see one more person is still typing. As that person is finishing, feel free. We have a few more minutes to field any more questions or comments. Okay, there's a question, as a BCBA, how do I get in with EI? Again, the resources that we have put in the handout, actually that VABA, V-A-B-A, that is on your handout actually has a link right on it, and it's noted on your handout. Jeannie just put the resource list, and again, it will be available. But they're actually, VABA is trying to encourage, if you're interested in EI, how you go about getting that information. There was one other question. What does the training look like? And again, the training related to early intervention, Catherine, feel free to jump in, but it is the same certification modules that are required for all early intervention providers regardless of discipline. You have to take online modules and sign an assurance that you will follow the practices of Part C, and then you apply to become certified through the state Part C office. Catherine, did I miss anything on that you would like to add?
You didn't miss a thing, and I would also just reinforce that on that resources page there's a link to a handout that tells people how they can become new early intervention providers.
Yeah, that's great. Thank you. ITC Stanton Waynesboro asked, what are some of the challenges that BCBA developmental services providers experience from the family-based setting? Examples, scheduling with the family, setting up structure, practice trials, data, etc. I'm never quite sure who I should ask. Selena, might you be able to jump in, and then Carol, if you can talk a little bit about what that looked like with Alice?
Sure, this is Selena. So having done family-based, home-based settings before, I think one of the biggest challenges that comes up is, of course, you don't have the same level of control in a home that you do in a clinical setting, and that would be true for any discipline, occupational therapy, speech therapy, physical therapy, for example. So as a BCBA, you have to understand what the home family or the home structure and the family structure are like so that you can design programs that are appropriate and that can actually be implemented by that family. So I think one of the biggest challenges I personally have struggled with, and I've heard this from many BCBAs, is sometimes I know if we could do one particular intervention, it might be the most effective intervention, but I know that the family may not be able to actually implement that with fidelity because of whatever reason. And so we might go with something that I don't know or don't believe that would be quite as effective, but I think would be better implemented. I imagine that other developmental service providers probably experience similar kinds of situations. Catherine, I don't know if you had anything to add to that.
No, I don't think so, but I can probably go ahead and start on the next question. There's one about families who are already receiving developmental therapy services not from a BCBA and are interested in ABA services. Is it possible to partner with an external provider and for a family to receive both services? I think certainly, and one thing I thought about when we were talking earlier, it's all, we're all about what family input and what works best for families. And so, I mean, it certainly could be a service that's listed in the other category in the IFSP, and it might not necessarily be paid for by early intervention, but maybe if the family is interested in receiving ABA services per se, maybe their insurance would pay for that. And so that might be something that you could certainly, invite them into the team planning, service coordinator contact with the providers of the ABA services. And I think it could be coordinated very effectively and be a great opportunity for the team to learn about the ABA services and perhaps, incorporate some of those techniques.
Thanks, Catherine. Yeah, Carol, I had asked, I don't know if you had anything you wanted to jump in specifically about how that looked with Alice or the past two questions. I don't know if you had anything you wanted to jump in.
Just a question from Stacy's group in Stanton. Our Alice really was so similar in how she worked with families as just like the rest of our team. So there wasn't anything unique when she scheduled, and I did mention that some of the families were interested in collecting data in between visits, so she would help them create a chart and review that with them. But really, it was very similar to what she did was very similar to everyone else on our team. So there weren't any issues that we had.
And I think one of the questions that I have, based on some of the questions that have come in, is we are not specifically talking about ABA. I think that was kind of one of the big things that became an aha moment for some of the COPA members who posed these questions, is that ABA is one way, but many of the behavior strategies that are part of ABA are used by all disciplines, regardless of how about challenging behaviors. I don't know if any of our presenters want to jump in any more on that. Please feel free to do so.
This is Selena. Yeah, I would just second that and add that, you know, ABA is a field of study, just like chemistry or biology or anything like that. But the strategies that are implemented, they're just parts of it. And so things like prompting and reinforcement, those are huge parts of ABA, but it doesn't mean that you have to have someone in a home 40 hours a week or providing a very intensive behavior plan to implement those kinds of strategies.
Thanks, Selena. Thanks, Selena. Let me see if I've hit any. I see that there are some more questions coming in, so I'm going to wait just another moment. Let's see here, shall we? Robin asked, this conversation is stress reducing. Yay! That was our goal, reduce stress. We just hired someone in-house as a service coordinator who is in the process of getting her certification as a BCBA. Hashtag winning. Love that. Thank you for sharing that, Robin. Rural Infant Services says, I do think that families are learning more about ABA therapy, though, and asking questions about it and requesting these services specifically. So it seems like we're in the role of educating families when we may not be as knowledgeable ourselves about those services.
Right.
And Catherine, were you going to jump in?
Yes, thank you. I just wanted to point out, there isn't really a lot of research that shows that, you know, the practice of ABA itself is beneficial in children under 3, but there are some very limited studies that may show, you know, certain portions of that, you know, the strategies they use are helpful. And again, recently there have been 1 or 2 articles about how, you know, teaching parents who can then, you know, apply those practices is beneficial. So for our age group, it's not necessarily an evidence-based practice at this point.
This is Selena. I would just add that, you know, again, we have to be really careful about what we mean when we say ABA therapy. And I love the quotes around it because I want to use air quotes when I say that. Because ABA therapy, I think we get a picture in our mind that it's that discrete trial training in a room for, you know, 20 to 40 hours a week, individual one-on-one therapy. And though there are some people that practice that, that's really not all applied behavior analysis is. So we have to be really careful, I think, as we're talking with families to help them understand what ABA therapy actually means.
That's really helpful. Thank you. Thank you, Selena and Catherine. I think that's really good information. And I think part of the thing is that the media and publicity, like Risk noted, people are hearing more and more about ABA, but particularly what that looks like. We don't have a lot of evidence for under the age of 3. And most of us have really good behavior management strategies, and some have even more skill. Phoenix says, well said, Selena. Okay, I'm going to do one more quick check to see if anybody else is typing. I do not see any more, so I think we are going to wrap up, and you guys have an extra 7 minutes of free time. I will leave the chat open for a couple more minutes if 1 or 2 more questions come in, because we can, Jeannie, if you will save the chat for us, we will be able to answer those questions if we've missed them or you just thought of them. So I want to thank everybody for joining us for our web discussion. On screen, all of our contact information is posted. You are welcome to call any or email any of the presenters today, and we will be happy to try to field questions. So thank you again for joining us. I hope you'll plan to join us in May when we will have a topic on social, emotional, infant mental health. So thank you and have a good day. Bye, everybody.